Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about a very important skin topic. It is nothing but psoriasis. So why are we discussing about psoriasis today is that, see, psoriasis is an autoimmune disease. So in conventional form of treatment, that is an allopathic form of treatment, we do not have any sort of particular cure for the psoriasis, but there is only management. And also because of the discomfort, itching and the disruption in the work-life balance and also the sleep disorder that this psoriasis causes. If we see about the prevalency of psoriasis in Western countries, it's more prevalent in the younger group, that is people who are from age of 8 to 15 years, and also it is again prevalent in the older group, that is people after 55 years. But if you take the Indian statistics or the Indian prevalency rate, it is much more common in age after 45 or after 40s, and also it's more common in males rather than in females. So let's get into the topic to know more about psoriasis. So let's see what is psoriasis. Psoriasis is a skin disease that causes rash as well as patches. As you can see the psoriasis is characteristically having, if you can see in the picture, this silvery scale appearance. This is the characteristic and the common feature of psoriasis. See, this is the differentiating feature between this and as well as eczema. So even eczema will have rash, even eczema will have this red skin, but this silvery scale-like appearance is the common characteristics of psoriasis. It is an autoimmune disorder and it is most commonly found in knees, in elbows, in back of the legs and also under the breast region. Now let's get into the symptoms and signs of psoriasis. As you can know that psoriasis represents itself with red, thick, silvery white scales and also cracked skin. As you can see in this picture, so there is silvery appearance, there is cracking of the skin, there is thickness associated with it, and also there is redness associated with it, and also it is very common, or the flare up of psoriasis is much common in winter seasons, but it is a little bit less common in the summer season. Some people will not be having psoriasis continuously throughout the year. Some people will have bouts of it, that is, it will appear in the winter season, it will appear in the rainy season, and it will decrease in the summer season, and again it will reappear in the next winter season. But for some rare cases it will be there throughout the year. Okay, and also there is poor sleep quality associated with psoriasis because of the intense itching and the burning associated with it, raised rashes and also small scaling spots and cyclical rashes. That is what I was telling you. See, in certain section of people, some people may have or may experience psoriasis in the summer, but it is very rare. People mostly experience the psoriasis symptoms worsening during the winter season. Now let's get into the investigations part of psoriasis. So after you have been diagnosed with psoriasis, first if you have any sort of cracks or ridges or the scaly appearance, after consultation with a doctor, they will ask you for investigations, and the primary one being the skin biopsy. As you can see in the picture, they will take a punch test, that is they will take a portion of your skin and examine it under the microscope to see what sort of psoriasis is there and how deep the infiltrations of the T cells are, and also how extensive the psoriasis is and what type of psoriasis. We can all confirm this with the skin biopsy. And the next is being power Doppler sonography. What is this power Doppler sonography is that, see, under the ultrasonography, they will see the blood vessels, how the blood vessel flow is and what sort of extent it is there, and also if it is associated with psoriatic arthritis or if there is any inflammation associated with all these other features under the skin can be seen through power Doppler sonography. Usually this is not insisted unless and until you have psoriatic arthritis, which is the problem of your joint. So usually they will do a skin biopsy if needed only. If they feel that it is very extensive and it can lead into psoriatic arthritis, they will be doing a power Doppler sonography. Now coming into the single nucleotide polymorphism or SNP. Remember that psoriasis is an autoimmune disease. So there are certain gene alterations or mutations that can happen. To know these gene mutations, we can do SNP. Usually when people are suffering from psoriasis in India, we advise skin biopsy. But in Western countries, they also do this SNP on a regular basis to see what kind of genetic mutations they have, and also if the further generations will get it. Now let's get into the structure and function of the skin to know more about the psoriasis and which layer of the skin it affects. As you all know, this is the skin structure, and this is the epidermis layer, and this is the dermis layer, and this is the hypodermis layer. The epidermis layer has dead skin cells, and it also does not have blood supply on its own. So blood from the dermis and the nutrition will move up to hydrate, to provide nutrition to the epidermal layer, and also epidermal layer will protect us from the external surfaces. So it acts as a barrier, and also this dermis layer will have blood vessels, it will have the oil secretion glands and all the other stuff. And the hypodermis layer is the subcutaneous layer which has the fat cells. So in psoriasis, which layer is affected? The epidermis layer is affected in the psoriasis. So what happens in the epidermis layer and how this epidermis layer is being affected, we will be learning in the body changes part. Now let's get into the risk factors for psoriasis. The primary, the most common and the most prevalent one is the family history. For example, if your grandmother or grandfather, paternal or maternal, mother or father, your sisters or your siblings are suffering from psoriasis, then you have a higher risk of developing psoriasis under certain conditions. Usually people who have family history do have a higher risk, and also the risk will get more, and that means you will get more prevalent for psoriasis under these circumstances, like certain medications. For example, you are using a lot of corticosteroids and you are suddenly stopping these corticosteroids. People who are using medications for hypertension, that is high BP, if they stop these medications, or if they are using medications from a longer period of time, from a very young age, if they are prone to infections, if you are having low immunity and you are continuously being affected, you are having low immunity and you are prone to infections, injuries, if you have any sort of cuts, if you have any sort of a little bit of burn also, that can also trigger a psoriasis or a psoriasis plaque in the body, and this is called as Koebner phenomenon. Environmental factors, being exposed to a lot of chemicals, and also obesity can also lead into or have a higher risk. This section of people will have a higher risk of developing psoriasis. Causes, as we have already discussed, a family history, that is the genetic history, mother, father, maternal, paternal, siblings having psoriasis, there can be a higher chance that you will be also suffering from psoriasis. Stress, see, nowadays usually psoriasis was not prevalent in India, it was much more prevalent in the western states because of the diet changes or the amount of food that they consume, the stress that they used to have. But because of the more urbanization that India is going on, we are seeing a rise in the psoriasis cases. Why is there a rise in the psoriasis cases? Is because of stress. People who are having improper lifestyle, improper sleep cycle, people are having a family history are more prone to psoriasis. Even if you have like improper work-life balance and you're stressed out for a longer period of time, a small cut on the skin, a small cream, even which does not have any sort of side effects, can also trigger psoriasis. So remember, the stress is the main component, especially for the Indian population, for the growing cases of psoriasis. Weather changes and also infections, having low immunity continuously under infections can also lead into psoriasis. And skin injuries, we have discussed, cuts, abrasion, wounds or burns, if you're under stress, can cause psoriasis. And in some people, these burns or these cuts can form keloids, that is hypertrophic scars as well, especially under stress. So stress is the main component along with the genetic factor. Now let's get into the body changes part of psoriasis. So what happens in the skin layer, especially in the epidermis, when there is a psoriatic attack? As you can see in the picture here clearly, this is the epidermis layer. As you can see, there is a bump here, that is hyperproliferation or increased proliferation. So what is proliferation? Multiplied cell division or a pile-up of skin cells because of the division. So why is this hyperproliferation of the keratinocytes? The skin cells in the epidermis are called as keratinocytes. And why is this happening is that, see, it can be a cut, an wound, an abrasion, a skin treatment that is going on, or a skin cream that you're applying. certain things can trigger certain allergies, okay, and the body will fight these allergies through the WBCs, to the T cells and to the B cells also. So what happens here in psoriasis is that after a trigger, it can be any sort of trigger, there is an inflammatory response. What is inflammatory response is that whenever there is an allergen near the skin, the body will undergo inflammatory changes. That is, first the blood vessels which are carrying blood will dilate, so that more amount of fighter cells can come and fight the area, okay, and this dilatation will cause redness in the area and also warmth. For example, if you have inflammation here, if you touch it, it will be a little bit warm, it will be a little bit red. And also this T cells are the problem here in this psoriasis. Usually what happens is this T cells should fight the allergen, but it can cause this T cells, because of the mutations in the genetic DNA, these T cells can cause hyperproliferation of the keratinocytes, or these keratinocytes can start becoming or dividing more. If this can take 1 week to 3 weeks for this pile up of the skin tissue, but in psoriasis, because of the activation of the T cells, it can take just 1 day or 2 days for this whole proliferation to cause. For example, if you're taking a keratinocyte and it is dividing and it is coming up to the epidermis layer, it can take for the dead skin cells build up to take 28 days. Sometimes it can take 2 to 3 to 4 weeks. But in psoriasis, what is happening is that because of the hyper proliferation, this cycle which should happen in the 28 days is happening in 1 or 2 days. That is why you will have this silvery, scaly, red, inflamed, plagular appearance in the psoriasis. The proper mechanisms, this is the pinpoint thing that is causing psoriasis, that proliferation mechanism or that pathological outline is not there. This is just how a simple hypothesis of how it will happen. So we do not know the exact pathophysiology of psoriasis, but people or the scientists feel that this is what is going on in the body. Now let's get into the types of psoriasis. The first kind of psoriasis, as you can see in the picture, this one is called as plague psoriasis. If we take 10 cases of psoriasis, 8 cases of psoriasis will either be guttate or plague. See, guttate psoriasis can also turn into plaguear psoriasis. First, we'll discuss about the plaguear psoriasis. This psoriasis usually appears on the trunk region, in the elbows, and also in the folds in certain section of people. Usually, it appears in the trunk region, and you can see this patches. Usually, it occurs because of stress, and it is the most common form of psoriasis. Then, coming into the guttate form of psoriasis, as you can see, the plaguear one, the inflamed tissue or that plague is a little bit bigger one, and it is covering a larger portion of area, whereas the guttate psoriasis in certain sections, from the guttate it can turn into plaguear. If it is guttate, you can see that the area of the plagues are very small. This is guttate psoriasis. This can be triggered either through stress or suddenly stopping a corticosteroid treatment. And then coming into the palmoplantar psoriasis, this can either appear on the soles of the foot or on the palms. It is usually seen in children and also in adults, that is age after 50 years. So who is experiencing this palmoplantar psoriasis? For example, if you are pregnant and you have had stress in the pregnancy, the baby coming out of you can suffer from this palmoplantar psoriasis either on the palms or on the feet because of the stress. See, remember, whatever nutrition you are taking through pregnancy will be delivered to the baby, as well as the stress also. So whatever feelings, the depression, the anxiety, the panic attack, or even if you are happy, all that form of things will affect the baby which is in your belly. So if you are experiencing anxiety, if you are experiencing stress during your pregnancy, make sure you take it under control, because the baby can have a trigger of psoriasis because of the pregnancy anxiety. And also people who are of older age can also experience this palmoplantar psoriasis. Next, coming into the nail psoriasis. As you can see in the picture, it usually affects the nails as well as the nail bed also. And also, not only the nail bed, there is infection also. If you see, we touch a lot of things with our hands. When you're experiencing psoriasis near the nail area, it can cause psoriatic arthritis if it is not treated properly, and also it can become infectious if you are not washing or keeping your hands clean, because you're scratching it continuously. There is open wounds, and also the infection can get, or the bacteria and yeast can get very easily inside the palm area. So remember, if you're suffering from palmoplantar psoriasis or from nail bed psoriasis, this can be infectious, or this can go into the secondary stage of infection because of the exposure to the external environment. We use a lot of our hands and our feet for working and for doing different purposes. So make sure you clean and disinfect, and make sure you get treatment properly. Next, coming into the other types of psoriasis, as you can see here, this is the starting stages of psoriasis, the red scaly skin texture. And then if it is not taken proper care, this can lead into different kinds of psoriasis. Usually this can lead into plagular kind of psoriasis. As you can see in the picture here, this is inverse psoriasis, which is usually present in the folds of the breast. It can be present in the folds near the elbow region, near the folds of the knee, anywhere the skin is folding, then you will have this kind of psoriasis. Then this is called as inverse psoriasis, usually present near the folds. Coming to this part, which is called as pustular psoriasis. See, this is not infection, this is just psoriasis which has pus in it. If not taken proper care, it can spread to the whole body, and also this can lead into infection, secondary infections also. So this pustular kind of psoriasis can be present usually on the limbs or on the hands, and even on the face, and in the lesser parts like trunk. Coming to scalp psoriasis, many people who are under stress, especially men, are more prone to this scalp psoriasis. Many people in the starting stage of the psoriasis feel that it is dandruff, and they take a lot of dandruff treatment, but that will also trigger or make this process run faster into psoriasis. So if you're suffering from itchy scalp, and if you're suffering from plaques which are silvery, and also if you're under certain stress, make sure that you're you differentiate if it is scalp psoriasis or if it is dandruff by consulting the doctor immediately. As I've discussed in the picture, I told you that this is the starting stages of psoriasis, and if not treated properly, certain people, when they're having a bout or a plague of psoriasis, they're exposed to sun a lot. The sun can trigger into erythrodermic psoriasis. See, remember, you can get proper vitamin D by exposure to sun either in the early morning or in the evening, but you're being exposed or sunburnt, then you can go into a state called as erythrodermic psoriasis, which can cause higher heart rate. You can have palpitation, that is, you can hear your heart rate, and also this is a widespread phenomenon. It can occur because of sunburn or because of higher use of corticosteroids. It can spread to the whole body. There will be severe itching, there will be severe burning, and also there will be disturbed or no sleep at all because of the severe itching associated with it. So if you are suffering from psoriasis, make sure that you do not go directly into the sun without proper physical measures like an umbrella, hat, or a covering. Next, coming into the conventional treatment part for psoriasis. See, whenever you are diagnosed with psoriasis, the allopathic form of treatment or the western form of treatment, the primary thing that they do is, see, everyone knows, like even if you type it in the Google, everyone will be telling you that there is no proper cure for psoriasis in allopathic form of treatment or in this western form of treatment. So what they do to manage the case? First thing is giving corticosteroids. As I already told you, certain people will have an inflammation or a trigger because of this corticosteroids. If you're using corticosteroids for certain things, like it can be pigmentation or any other thing, and then there is sudden stop of this corticosteroid, that can trigger psoriasis in certain cases. By giving topical treatments of steroids, it will subside, or it will just stay like that without any proliferation for certain period. The moment you stop the corticosteroid, it will increase. That is, the psoriasis itching, burning, and also the severity and extent of it can also increase after corticosteroid stoppage. Vitamin D analogs, people who are suffering from low vitamin D can also have this psoriasis. So they will prescribe vitamin D. They can prescribe salicylic acid, which is a beta hydroxy acid, for exfoliation. Those rough patches and all, they get exfoliated with salicylic acid. Here there is nothing being done to the cause of the psoriasis. And then topical retinoids to thicken the skin, and also to enhance the exfoliation, that is remove the outer scaly layer. And then systemic medicines like methotrexate and all of these stuff. So what is happening in all of these medications or all of these topical treatments or all of these UV radiation therapies is that it will remove the symptom for a shorter period of time. For example, if you are having this psoriatic attack during the winters, or if you are having it during a certain period of time where it is very stressful, or during your pregnancy and all of that other stuff, there are certain medications which cannot be given during pregnancy, first thing. Second thing, all of these medications, including the topical steroids or any sort of medications, they will have their side effects, and also they are just helpful in managing the case of psoriasis but not curing the cause, and also it does not do a good job even in managing because of its side effects. So what should you choose if you are having psoriasis? Homeopathic treatment. You should be opting for homeopathic treatment for psoriasis. Now let's get into the homeopathic treatment part. So why should you be choosing homeopathic treatment for managing your psoriasis cases? The primary thing is that it does not have any sort of side effects, which is very important because you're already suffering from it. Second thing is that it is safe, timely, and holistic in nature. What do you mean by holistic and individual? For example, two people in your family are suffering from psoriasis. One will be suffering because of one sort of stress, and the other can be suffering from different sort of stress. But in allopathic form of treatment, they will be giving you same type of topical steroids for both the cases. But remember, you both are two different individuals, even if you are belonging to the same family. So your stress, it can be financial stress, it can be any sort of other stress. We will deal with it, or we will take your case and we will give a medicine which connects your mental state to your physical state, because the physical state is the representation of your mental state. So we will be giving holistic medicine which will target the cause or the stress, and also there is cure inside out. We will be able to manage the case, the number of recurrences. For example, you are having frequent recurrences of the psoriatic plague, that recurrences will decrease in homeopathy. And also there is individualistic treatment and overall improvement in health. Your immunity will be improved, your itching will decrease, the burning will decrease, the plagues will decrease without any side effects. We will be able to prevent further recurrences if you're taking treatment on time, and also we will be able to relieve the present cases of psoriasis. What are the precautions you need to follow if you're suffering from psoriasis? Remember, the psoriasis is all about the triggers. It's about family history and it is about stress. So managing your stress is the primary thing. See, for example, if you have a family history and you're under stress, you're under high risk. So if you're having a family history, you cannot do anything about it. What you can do is managing your stress. Try to do medication, try to do yoga, try to do stretching or any sort of exercise that will calm down the stress. And make sure you're not going directly into the sun. Try having physical barriers like an umbrella, a hat or a scarf if you're going directly into the sun. And also if you're having very allergic or reactive skin, try avoiding sunscreens which have a lot of chemicals in it. So, and also make your healthy routine, that is improve your diet by taking a lot of vitamin C, that is kiwi, oranges, it can be guava, it can be lemon. Take a lot of vitamin C so that even if there is a wound, even if there is a trigger, the body will be able to handle this wound healing properly. And also try avoiding swimming pools, try avoiding beach baths, and also try avoiding wearing synthetic clothes. Wear cotton or natural form of fibers. And also drink a lot of water. Make sure you moisturize your skin, and also use squalane oil. See, squalane oil is the most form of natural oil which resembles the oil in the skin. So by applying squalane oil directly on your skin for a longer period of time, if you're suffering from psoriasis, can relieve the symptoms to a greater extent. So what happens if you're neglecting this psoriasis? Remember, if you're neglecting the psoriasis, you're not taking any precautionary methods, you're not consulting a doctor. First of all, you do not know what kind of psoriasis it is and what are the triggers of it. And also, you do not know if it is psoriasis or eczema or any other disease. So first you have to get it diagnosed. And even after diagnosis, if you're not taking proper care of it, it can lead into psoriatic arthritis, and also it can affect your mental health because of the improper sleep patterns, because of the increased itching. It can cause work-life disruption. It can cause systemic health concerns because it is an autoimmune disease. It can trigger other autoimmune diseases as well. And also it can cause untreated psoriasis, can cause a lot of flare-ups. For example, if you're suffering from a guttate psoriasis here, you have not taken any care, you're going directly into the sun, you're not drinking enough of water, no vitamin C, no proper food, improper lifestyle and stress, this guttate psoriasis, which is a smaller plaque, can turn into a plagular psoriasis, which is larger flaky skin, and also it can spread to the whole body also. So make sure you take doctor treatment as soon as possible. Coming to the consultation part. Say if you're suffering from psoriasis, eczema, any other skin diseases, you're looking for proper cure, and also you're looking for a good, better form of treatment, then you should be consulting Fidicus Homeopathy. So in Fidicus Homeopathy, we have in-person consultation and also online consultation. If you're staying near the nearest branch of Fidicus, we would advise you to come in person and consult us. No, if you're staying away, far away, you can get an online consultation. We have two options here. One is audio consultation and the other one is video consultation. And after the consultation, if you have any sort of skin investigations, you can share it with us. And if you need any more, we will ask you to get a skin examination or an investigation done. After the doctor consultation, the medicine will be delivered to you directly to your doorstep. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. And anywhere across the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call through this number or WhatsApp us or ping us or messages on this number. If you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you are suffering from psoriasis or any other skin diseases, if you're looking for top sort of treatment, you're looking for a proper cure, doctors who will treat you properly, then you should opt for Fidicus Homeopathy. Why should you opt for Fidicus Homeopathy? Because it stands for highest chance of health. Here, because they are already treating patients who are suffering from psoriasis and other skin diseases, and the success rate is really good. We have high success rates, the transparent treatment, there's no gray area between the patient and the doctor, and also the personal care here at Fidicus, that is if you're having any sort of myths, any sort of doubts, what about doubts about your prognosis, all of this will be educated, and also the personal care is really good in Fidicus. So if you want to opt for cure, opt for Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.